if you could go ahead and put yourself on mute, it looks like, there we go. Got Garrett, can we go ahead and put everybody on mute? That'll be helpful. We're gonna get started in just a second as we're letting people in. Thank you all for joining us. And just a reminder, if you're not on mute, if you could please put yourself on mute so we don't get all of the feedback. Welcome, everybody. I'm Ryan Hampton. I am the organizing director here at Recovery Advocacy Project and Recovery Advocacy Project Nevada. I want to thank all of you that joined us last week for our first legislative session. I cannot believe that session starts in just a couple of days. We've been really hard at work here at RAP the last couple of months and preparing for this. There's some phenomenal legislation that's going to be on the table that we're going to be working really hard for and advocating for. And we appreciate all of your support in helping to get us this far, but all of your support in joining us this evening. The chat is open. So as we go through this grassroots organizing presentation and you have questions, feel free to just pop them into the chat. We'll be addressing them at the end of the evening and have kind of an open forum if you have questions about some of the legislative priorities that we have. We did go over some of those last week, and we can get you a video of last week's training if you did miss it. Just email Anna Maria and she'll provide her contact information at the end of this presentation. So there's a lot that we're going to be able to do together. And even though we're kind of physically distant right now, and the majority of session is going to be conducted right on this platform, it sounds like on Zoom, that also creates a lot of opportunity for us. Shortly, you're going to hear from a few folks and our friend Lisa Lee, who's joining us around testimony and providing oral testimony and written testimony. Folks from different parts of the state, it's going to be a lot easier to provide testimony at this year's session because you'll be able to do it on Zoom. The process for how to get your name on that list has not been released yet, but as soon as it does, we'll be in touch with all of you and individuals that would like to participate in this process, and there will be a kind of a method to that we'll go through at the end. So if I could get the next slide, please. I always like to open these sessions by just kind of giving you a glimpse of who we are, really where our values come. Everybody asks, well, what is Recovery Advocacy Project Nevada? Well, this is our mission statement right here. We're a network at our heart of people and organizations actually around the country, but we are centered and focused here in the state of Nevada, advocating for addiction recovery policies. We're committed to giving people in recovery, family members and supporters of recovery, grassroots organizing tools to think and act locally. We're working to build a visible and effective constituency in demand of community and public policy-based solutions in response to our longstanding addiction crisis. If I can get the next slide, please. So the agenda for tonight these are the things that we'll be reviewing. We're going to go over the purpose of grassroots advocacy and ways to get involved, why we do the work that we do as private citizens, as advocates, as members of our community to move these policies forward. Then we're going to hear about the power of our own personal stories and how we can provide effective oral and written testimony during this coming legislative session. We'll hear a little bit about relational organizing, which is the power of kind of the one-to-one organizing and engaging people in your community that you have a relationship with to get involved in these legislative priorities that we have. We'll provide a brief overview on how you can reach out to your legislators and other ways to support our efforts. You know, during our last week's session, there were a lot of questions around a piece of legislation that we have on the table right now, Senate Bill 69, around peer recovery support services. So Sean O'Donnell from Foundation for Recovery was able to join us tonight to give a little bit more of an in-depth overview of that bill and answer your questions, because there was a tremendous amount of interest in that bill. And then we'll just do a brief overview of some of the other legislation that we're tracking and hopefully ask all of you what you're interested in, whether it's talking to the media or providing testimony or contacting your legislators or engaging others to contact legislators. There's a whole menu of options. And we're going to ask, hopefully, that you'll have some interest in one of these options. And then we, the team here at RAP Nevada, will help you in these actions. That's what we're here for. And of course, some questions and answers. So for our first part, I'm going to kick it off to our incredible field director, Maria Hernandez, with Recovery Advocacy Project here in Nevada. Maria.
Thanks, Ryan, and hello, everybody. It's very nice to see all of you here with us today. And well, today we are gathering because we're going to talk about different ways that we can engage with the legislative session that starts in just a few days. So we're going to be doing all levels of advocacy, which is speaking in favor of recovery, right? And in favor of all of the recovery issues that we have. So we are going to, advocacy really happens at a lot of levels instead of our own personal networks in our communities, amongst local and state agencies throughout the legislative process. So we're really going to be talking about how we as private citizens and advocates are going to try to sway how this legislative session goes through educating our communities and connecting with our legislators and being in favor of certain bills. So to speak a little bit more about personal experience doing advocacy and providing testimony during the legislative session, I would like to introduce Lisa Lee.
Good evening, everyone, and thanks for joining us. My name is Lisa Lee. And a little bit of background, my mom has been a lobbyist for over 40 years. So I pretty much cut my teeth in city council chambers and county commission chambers and the Nevada state legislature. Back in those days, we had to thumb through paper legislative digests, and it was much different than this session, which will be held online via Zoom. It should be a new experience for everyone. If anyone tuned into the special session, it should be something like that. So I wanted to give just a little bit of information around what we mean by lobbying, which is really just communicating your position on an issue and harnessing the power, the people power of the folks in your network to also either contact their representative to support a bill or to be opposed to a bill. So really just networking and also learning about what you're supporting or opposing and what that process is like. So these are all essential tools to know who is involved, who is the sponsor, co-sponsor, who sits on those legislative committees, and then what the issue is, what the opposition is as well. It's really good to know what the oppositional viewpoint is. Know why this is meaningful to you in your community or your family, or how it impacts you and the people you know personally. And then how, which is how do you participate in this process? So there's a link here, and I will put this link in the chat as well in a bit here. This is where to look at bills. You can search through this tool called Nellis. You can search terms. You can search who your representatives are that are sponsoring bills. You can read through them. You can read amendments to those bills. You can see where they are in committee, and you can also subscribe to track it. And so it will hand you, it'll email you a digest about what is happening in session and also where your bill is heading. So you'll get to know the process in greater detail there. And then know the players. It's really important to get to know your representatives as constituents, and also get to know the folks who sit on committees and kind of how that process works. We'll go over that for the bills or bill draft requests that you're following. So this is kind of the process that happens. Just to recap, if any of you joined last week, this was kind of introduced. So legislation in our state is introduced in at least one chamber, and how it works here is either in the Senate or the Assembly. Then it's assigned a committee based on the issue of the bill. For example, if it relates to substance use or housing or something of that nature, it'd probably be referred to Health and Human Services. So it goes to that committee, and then it might be referred to a subcommittee. The committee decides on whether a bill will move forward or be amended or be tabled. A lot of bills die at this point. They die in committee, meaning they just sit there and they don't get to move on. If it moves forward, then it's considered on the chamber floor where it's subject to further amendment. And then it goes through this process in both chambers. If both chambers approve, then the committee kind of works out any differences, especially amongst, opposition and support. And then if both chambers approve, it goes to the governor's office, either for a signature or a veto. Next slide, please. And so the what about this is learning all you can about the issue being presented. Research the issue, know what you're talking about when you go up to give oral testimony or written testimony. And I find it helpful to kind of discuss, debate, and strategize with your network. So, your social circle, talk about these issues, have them poke holes in kind of your framework there. And then also, like I said, know the opposition, know what the argument is against passage of this, and then connect it to your own personal why. Know your position, and then start to frame that persuasive message, which lots of people call an elevator pitch. I personally feel the best way to do this is to write it out and then read it out loud. I test this with my children because we have to remember we're presenting for lay audiences. And I find my kids are really good at telling me, like, I don't understand what you're saying. And so you can reframe it a little bit. So read it out loud, edit it, and time it, because typically for public testimony, you have 2 minutes or 3 minutes, depending on the rules. And so time it. And then you have to decide whether to give oral testimony or if you want to give written testimony. Next slide, please. So oral testimony, we are a species of story. Stories are powerful, they're impactful, and they put a name and a face to issues. And also the thing is stories, you are subject matter experts on that experience and how these issues impact your life. And so in that way, it's even more powerful because you're able to be that subject matter expert to folks that may just be laypersons around the issue. So you're going to develop a few key points that you would like to address. And again, avoid jargon, just talk about the issue in a way that people can understand. Connect that personal to the political, as Carol Hanich said in the 1969. And again, you're going to read it, or you're going to write it, you're going to read it, edit it, read it, and time it. Again, if you're working with a coalition or a network or an organization or a larger affiliation, you can get together and host these grassroots organizing sessions and have everybody practice. Really get your strategy set. Here's kind of the general format to follow. You're going to introduce yourself, thank everyone, including the chair and the committee or body that you're presenting to for the opportunity to speak, and then provide your position on the bill very clearly. You're either going to present your argument for or in opposition, and then connect it to your personal story to really demonstrate your position and why this is impactful. Your stories have power. Then move into the conclusion, maintain solution focused, because I found that policymakers generally stop listening if you're just complaining and complaining and complaining without proposing some sort of path forward or a solution. Restate your position, and this means, you're asking them, this is why you should vote yes on AB whatever, or SB Senate bill whatever. Restate your position, and again, close with thanking them for the opportunity to present. Next slide, please. Written testimony. So this will go down in the permanent record. You can thumb through previous sessions and see records of this where people or organizations have submitted letters. And I find this a really good way to be, to see your work in action and to see the work of your network in action in written testimony. And again, you follow a similar path, but it isn't the same. It's not the same as being a living, breathing human face-to-face with your representatives. In written testimony, you're going to start with that header, your salutation. So again, you're addressing the chair or whatever body you're presenting to. In your first paragraph, of course, you're going to identify yourself, and if you're affiliated with any, you're a constituent, you have an organization affiliation, you have whatever, you're a family member, you're a person in long-term recovery, your affiliation. Then you're going to state your purpose and your position on the issue, introduce your key points and why they are important. Again, you're arguing for or in opposition. And then in the second paragraph, this is where you can unpack your personal story to demonstrate your position, how this issue will affect you, your organization, your family, your community, however you're framing it. And then again, offering that solution and path forward. And then sum it up in that last paragraph. You're again thanking them for the opportunity to share your concerns as a constituent or as wherever your affiliation is. And then this is where you're going to clearly ask them, I am urging you to pass whatever the bill's name is, clearly in that. And then of course, wrap it up and sign your name. Next slide, please. So some considerations, and again, we aren't quite certain how it's going to shake out in this next session. During the special session, providing oral testimony meant calling into a number, and then you waited for a really long time to be able to speak, or there was an email address you can provide your written testimony and you could send it there. So you're going to have to think about how to sign up for oral testimony. Typically, when you're in person, you go and sign up with the clerk, you fill out a little card. The clerk calls you when it's time for that item to be heard. You usually state your position that you're for, against, or neutral. This again this session will look different because it's all online. And then I found in the special session, it was a really great strategy. Oh, wait, no, sorry, this is a different point. This point is around having your message delivered by the right messenger. And so if there's somebody with, social capital, with those lawmakers, it sometimes is a really good strategy to have them deliver that message on behalf of your coalition or your organization. So definitely know who's in your circle, know who your partners are, and know their social relationships, because it might be beneficial. And then building those alliances and coalitions really, really helps push things forward. I have found that using GroupMe which is a group messaging platform, is really, really beneficial to organizing on the spot and to getting, kind of strategizing around oral testimony and all of these things. I've used it in the past, and it was definitely beneficial this last special session, working with some attorneys from the ACLU. It was great because we were communicating in real time. So I urge you to use one of those platforms so you can communicate with your network and really strategize. And then, of course, you can use media advocacy to bring awareness to your issue as well. Next slide, please. And so I would like all of you to remember that you can make a difference. We do live in a democratic republic, right? We elect representatives to work for us and to represent our best interests. They don't know what those best interests are unless we let them know what's important to us in our communities. And that really depends on you. So you can make a difference, and a big difference. And then this, we are better together. I think about, that scene in Finding Nemo when they're all in the net. And the idea is if we all just swim in the same direction, just a little bit, you get movement. In that case, you get freedom, right? And so I think about that and really for me, it's a very impactful analogy that if we just all push just a little bit in the same direction, we make a big impact. And then remember, you are a subject matter expert. You are a subject matter expert on issues that are deeply meaningful to you, that have impacted you and your loved ones. And policymakers, they know a little bit about everything, but they need your expertise to make decisions. So I urge you to all get involved and connect with RAP and be active next session. Thank you so much for this opportunity.
Thank you, Lisa. And I just want to just emphasize that last bullet point about being the subject matter expert, right? And I just want to say, there are a lot of people who are categorized as subject matter experts, but I put, people with lived experience who are on the ground right at the top of that list. And sometimes I can even get intimidated when I'm sitting next to or testifying next to or providing information next to people who have the whole alphabet soup next to their name, very important opinions, and also other policymakers. And usually we have a very different perspective to bring to the table, and one that is incredibly valued as constituents in this state. So do not be intimidated to jump into this process, because they actually need us to make good policy, right? And I think there's a saying, and my mom used to say it to me a lot, and it rings true, and it comes up a lot. It's like, if we're not at the table, right? We're not at the table, usually we're on the menu, right? I mean, that's kind of the truth. So we want to make sure that we create space to bring as many people to that table and build a larger table so that we're involved. And now I'd like to kick it to Maria Hernandez.
Thanks, Ryan. And with that same idea of bringing more people to the table, one of the best ways that we can do that is by using relational organizing tactics. So organizing inside of our communities is all about generating people power amongst people that all share an interest to create change. And relational organizing is about strengthening the relationships that we already have to build that people power inside of our own communities. So people usually take action and get involved because they can and because they want to, and mostly because they were asked. And it is shown that we are more likely to take action when that ask comes from somebody that we already know, love, and trust. So in order for us to be able to spread awareness about the bills that we will be supporting this legislative session, it's very important for us to be able to organize inside of our communities and be in touch with everyone we know about why we're doing what we're doing, why we are getting involved, and why we want everyone in our networks to get involved so that we can make sure that we advance our recovery platform in the Nevada legislature. So in addition to really building our communities and educating our communities about what is going on in the legislative session that impacts us, another thing that we want to do is reach out to our legislators and communicate with them so that we can advocate for change. So phone calls, letters, and emails are all safe ways that are also practical to speak with our legislators right now during pandemic season. So make sure, Lisa just gave us a great rundown on exactly how it is that we should speak with our legislators. And just to recap a little bit of what she said, whenever we are reaching out to them, it's always important to be clear and concise about why we're communicating with them. So be clear about the issue that you're speaking on. Reference any laws or bills that we may be supporting. Also share your story and talk about how the issue impacts our communities, and always provide pathways to move forward, like Lisa said. And over here, there is a link that I will put in the chat where that allows us to find our Nevada legislators. The good thing is that through RAP, we actually have templates that are already all set up. And all you have to do is go to a link that we will share in a little while. And you just have to follow the prompts to be able to draft a letter that there's already a template for, so that you can send to your Nevada legislator right now. So it's easy to communicate with our legislators. We just have to make sure that we make a point to do so.
Thank you. I want to just pull attention to something that Lisa put into the chat. She said, you know, you're never too young or too old to get involved in this process. She said last legislative session on the peer bill, her 12-year-old daughter was there with the Nevada Youth Advocacy Alliance, and mom was there advocating for the bill. And there were 3 generations there working on the same bill. And, you know, the whole purpose of this call, this second call that we're doing, is to kind of give you a glimpse into what are the things that we could be doing together and what RAP is here in existence for to help you with. Specific to Anna Maria's pitch, I guess you could say, on relational organizing, is right now there's, you know, 33 or so people who are on this call. It's on our Facebook page. There'll probably be a few hundred that listen to it. If each person, you know, commits to taking action, but then also for those of you that have a network, you know, we all have a shared, I think, kind of purpose in this work, and knows one other person, you know, that may want to take an action. Ask them to take an action. Ask them to get involved in this legislative session. We'll help do a lot of the heavy lifting in terms of, you know, assisting with, you know, drafting and helping you with your testimony. And, you know, we've got great trainings on the power of story and how to effectively communicate your story of self and story of us and story of now in our community. Some of these actions right here, other ways that you can support: speaking publicly about your advocacy and your story, whether that's on social media with friends or family or groups you belong to. You know, sharing my story for the first time a few years ago in a public way, and certainly with policymakers, was quite frightening the first time I did it. But we have trainings, we have tools, we have a peer community of other advocates that will help provide kind of best practices and their own experience through that to make this a little bit more comfortable for you. Letters, you know, Anna Maria referenced the templates. We have plenty of templates of letters for legislators on all sorts of specific pieces of legislation, depending on which one, you know, is closest to your heart. We will help you with that. Media, you know, one of the tools that we have that sometimes is underutilized is the power of the media. Our local market media here in Nevada, broadcast and print, are always looking for good content specifically around legislative session that comes from people who are impacted. My experience, And I think the evidence points to that media sometimes would much rather hear why a constituent, why someone who's impacted is supporting or opposing a piece of legislation rather than hearing, from an outsider, I guess you could say. So if media is your thing or you're interested in media, contact us. Put your intent in at the end of this call. There's going to be a box that you can check, and we will work with you in identifying the right place to place a piece of media, what story you'd like to tell, what piece of legislation you'd like to support, how we can weave the narratives together to make an effective message for voters and constituents and policymakers in your district. Same thing with op-eds. Those are your personal narratives, and you can submit those to any of the Nevada print and digital dailies. And again, we will help you on that submission. And then if you're looking for additional resources, again, we're a hub kind of learning, of training, of advocacy, boots on the ground. Check out recoveryvoices.com. We have a great guide there on effective public testimony, on sharing your story. And for those that are wondering, like, how do bills become laws in states, we've got a guide on that too. We do want to make sure we've got room for some questions at the end. So I want to go ahead and just introduce Sean O'Donnell with Foundation for Recovery. There were a lot of questions around the peer bill, SB 69. So he's going to give just a very brief overview of how we've gotten to where we're at with the peer bill, and answer your questions that you may have about it. Sean?
Yeah, thanks, Ryan. And thanks for inviting me tonight, Paul. Last week we talked a little bit about SB 69 and what what this bill is going to be doing. We have been focusing specifically in these meetings talking about the certification requirements for peer recovery support specialists in the state of Nevada. Today I'll talk a little bit more about some of the other sections. But before we dive into that, just for anyone who's joining who might not know exactly what is a peer recovery support specialist, what are we talking about? Why does this piece of legislation matter? I thought it would be helpful to go over, well, what is the current process to become a peer support specialist in the state of Nevada? And what are the certification requirements currently? And what does a person do who holds that title? So we can go on to the next slide. So a peer recovery support specialist is often also referred to as a recovery coach. Those terms are kind of used interchangeably. Here in the state of Nevada, we use peer recovery support specialist more frequently than we do recovery coach. Recovery coach is a title that we hear more commonly on the East Coast, but it's referring to the same title. And essentially what these people are doing is they're people who have lived experience in recovery from substance use, problem gambling, mental health, or any other co-occurring challenges. And they use their recovery experience to provide support and hope to individuals working through their own recovery. So it's somebody who has gone through appropriate training, but is really able to connect with the individual they're working with, who is either new in recovery, seeking recovery, in long-term recovery, however they define that, and being able to work with that person to identify goals and help them reach their goals. And one of the key benefits of peer recovery support is that it removes this power differential, right? It's a completely different relationship between a peer recovery support specialist and a peer, compared to like a clinician and a patient, right? Although that relationship is also very beneficial, it's just a little different. So the current requirements, and this is an established workforce, I'll mention, it's been established for decades, actually around the world. And it's one that is certainly emerging here in Nevada and elsewhere. The current requirements to become a peer recovery support specialist in Nevada involves, well, first of all, training. So the peer recovery support specialist training curriculum, if you're interested in becoming someone in this role, is a 46-hour training, which falls into 4 different domains. 1, 10 hours in the domain of advocacy, 2, 10 hours in the domain of mentoring and education, 3, 10 hours in the domain of recovery and wellness support, and 4, 16 hours in the domain of ethical responsibility. Currently, the approved training bodies in the state of Nevada are Foundation for Recovery, which is Nevada's statewide recovery community organization. 2 is the University of Reno. They offer a 12-credit PRSS training course. And then also through UNR and CASAT is a 46-hour, online course that you take self-paced, whatever that looks like for you. So we can go ahead and go on to the next slide. And then if somebody, in Nevada, we currently have a voluntary certification process. So if I want to provide peer support, I'm a person with lived experience and I want to give back to my community. Currently, I can go through that 46-hour training through one of those 3 training bodies in our state. And then I could go ahead and turn around and start volunteering with an organization like Foundation for Recovery or NAMI, or any other organization and start providing peer support. Maybe I help out on a peer warm line just a couple of hours every month, and I'm satisfied with that. And maybe I do want to go on and seek a certification in the state of Nevada. And so what that process currently looks like is after you complete the 46-hour training, we have a certifying agency here in Nevada called the Nevada Certification Board. The Nevada Certification Board is a separate entity. It's not a part of, it's not like a state department or anything. And they currently do certification at the state level for peer recovery support specialists, community health workers, and prevention specialists. So if I want to go and get certified in the state, I currently go through the Nevada Certification Board where after I complete the training, I take the test. I should have already completed 200 to 500 hours of experience. And I have all these other, qualifications. I pay my fee in order to get that certification and I take my test. And then once reviewed and approved, I'm now a certified peer recovery support specialist in the state of Nevada. So what SB 69, this bill that we keep talking about, does is it actually will start to mandate certification for peer recovery support specialists in our state. So no longer will it be a voluntary process. Now you will be required, if you want to hold the title of a peer recovery support specialist or offer peer recovery support services, you now have to go on and get certified through the state. How the bill is currently written, since the Nevada Certification Board doesn't have any legal authority to create rules or regulations, that is given to the Board of Health, how the bill is currently written. So the Board of Health actually has authority to define through the regulatory process what are the requirements going to be in order for somebody who wants certification to achieve that. The bill currently does still mention the Nevada Certification Board in there. So one would have to meet the requirements of the Nevada Certification Board, and then any other, requirements defined through that regulatory process under the Board of Health. Once I complete that, I'm certified in this state and I'm able to go and get a job or volunteer or hold the title of a peer recovery support specialist. What's also new in this section is the requirement for anyone who is actually supervising supervision for peer recovery support specialists. They now actually have to get certified as well. And again, the Board of Health has the authorization, the authority to create rules and regulations around, well, what is the certification process going to look like for peer support specialist supervisors to get certified in our state? And so that is also written into the bill. Because it is mandating peer support, then there has to be actually a penalty associated with not complying with that mandate. So if I were to go and start telling everyone, hey, everybody, I'm a peer support specialist. I haven't done any of the training. I haven't gone through the process of getting certified in our state, and I'm holding myself out with that title. That could be dangerous. It could be dangerous to the person that peer support specialist is providing services to. It could be dangerous for the public. So there is a penalty associated with this, that it would be a misdemeanor charge. And again, the Board of Health is in charge through that regulatory process to define how that is going to be enforced, that misdemeanor. So that is I guess, nuts and bolts, most of the peer support specialist section really like a brief overview of that. Anybody can go on to Nellis and search SB 69 and look at the bill text. The bill starts with what's called a legislative digest. And that legislative digest is essentially going to kind of run through what each of the sections mean. And then you'll get into the meat of the bill. Anything in blue text is new text that is added, that will be added into statute if this becomes passed, right? It's new language.
Sean,
So,
we have a couple of questions, or one question, if it's okay. If
sure,
folks
let's go
have
ahead.
if folks have questions specific to the bill, you can go ahead and drop them in the chat now. We'll just do questions on SB 69 now before we move into the next section. One of the questions that did come up was, and I'll address this to either Sean or Lisa, or you can both take it. Other states have struggled with maintaining the purity of peer support once states mandate being certified. How or who will help ensure that doesn't happen once the legislation is passed?
So I'm really glad, Matthew, that you asked that question, because that has also been a concern of both Lisa and I's and other stakeholders. Like I mentioned, how it's currently written, the Board of Health essentially has all this authority to create those rules and regulations, but the Board of Health isn't comprised of any peer support specialists or people in recovery or consumers. And so where are we in that process, right? When those rules and regs are being developed. So I guess one is that there is a gray area, right? There is potential for some rules and regs to be developed that maybe aren't, maybe could damage the authenticity of peer support, and we definitely don't want that. And so during the regulatory process, there are several ways for us to be able to stay vocal, share our concerns, share our feedback, share best practices as they develop these regulations. One is, usually we've been told that the Board of Health, when pertaining to issues that they're not subject matter experts on, they will usually organize some type of like stakeholder group to help advise what this should be, whether that is through our Department of Public and Behavioral Health or through the Board of Health, just to get feedback from the public. The second is through that regulatory process, there will be opportunities for open public comment as these regs are developed. So that's when we can submit our comments to like an open docket, or if they host like an open meeting, something like that. Also, let's just say that the Board of Health were to create some really harmful regulations, right? Well, it doesn't just pass right away. It then has to go back to the legislature. And actually there is a committee. It is the Legislative Committee on Healthcare. So the Legislative Committee of Healthcare is comprised of legislators, and they can provide their recommendations on how the regs are currently written. Constituents can provide feedback to that legislative body. They cannot accept or reject those regulations, but they can provide comments. It then moves on to the Legislative Commission, and the Legislative Commission can take those comments from the Legislative Committee on Healthcare and the public, and then they can decide, nope, we're going to reject this, send it back to the Board of Health. You guys have to work some stuff out with constituents, or they can accept the rules and regs. So we do have to be vigilant throughout this entire process, even after the legislative session, if this were to pass and become law.
I'm going to pass it to Lisa.
Sean, if I may, I also wanted to tell everyone that they have the ability to get involved when the bill is first presented, and some of the talking points that we would love to have in the legislative record, again, looking at written and oral testimony, are some of the following things. Currently, our Nevada Certification Board is an affiliate of the International Credentialing and Reciprocity Consortium, ICNRC. We would like to retain that. It's really imperative for peers that are moving across state that their certification in one state be reciprocated in another. So that's some of the messaging, is maintaining the ICNRC standards affiliated with the Nevada Certification Board, and that the Board of Health, the State Board of Health, honors its commitment to maintain stakeholder engagement in every part of the process. And so just knowing that 50 years down the line, that testimony that you provide will still be part of the legislative record. So, you know, if things go awry in the future, it can go through the process that Sean just described. They can look at the bill and look at the legislative record and ensure that the spirit and intent was followed. And so your voice does matter even far into the future. Thank you.
Yeah, that's a great point. Like when the bill is heard in committee, it will be important for us to have, you know, unified voice on what the intent is, right? So like, you know, we want X, Y, and Z to make sure that that happens. So then that does go into legislative record. And we can help provide talking points around that too pretty soon here.
Great. Thank you, Sean. If we could go to the next slide, I just want to give just a really quick, just brush overview of some of the other legislation that we're tracking. We just talked about SB 69, which is one of the main pieces of legislation we're tracking around peer recovery support specialists. SB 70, establishing procedures for placing a person on and releasing a person from a mental health crisis hold. SB 56, which is more around insurance coverage and behavioral health services, extending telehealth. SB 32, making changes related to offenders with substance use or co-occurring disorders, which requires the director of the Department of Corrections to establish programs of treatment for offenders with SUD or co-occurring disorders. Next slide. SB 5, which makes some changes relating to telehealth. SB 40, which is more around data collection, so we have better data and outcomes on healthcare. And then there are 2 BDRs, bill draft requests, 497, which we haven't seen in the language for yet, but it's around Patient Protection Commission. And then BDR 750, which will be another kind of priority piece of legislation, which once it comes out, revising provisions around governing recovery support services, but at its heart, the intent of that bill is going to be to have a set aside of 15%, I believe 15% out of the alcohol fund, which will go to fund recovery support services in the state of Nevada. So that obviously is going to be an important piece of legislation for us. All of these bills, you can get more information from us directly and just contact us directly. I do see another, oh, that's from Sean. Sean had written, there's other also sections of SB 69 that pertain for SUD education, youth risk behavior surveillance, system survey, and certification for prevention coalitions in the state. We can provide way more in-depth analysis of these pieces of legislation if you'd like, and we can just connect after this call. So next steps is we need help. We can't do this alone. We cannot have a go it alone strategy. That's never successful. Anything that you're interested in doing, some of the actions we talked about before, writing an op-ed, talking to media, providing written testimony, possibly providing oral testimony, live testimony through Zoom or for phone call. If any of these are things that interest you, we are here to help you kind of get to a point where you're providing effective testimony. Many of you have already probably done this before and know how to do this. We need your support in getting this legislation past the finish line in this 81st legislative session. So Anna Maria is going to throw a link into the chat. And we're also going to email this out to everybody after the fact. It's just a very simple survey where you could just say what you're interested in, and we will contact you following this call as we enter session to work with you on whether it's testimony, media, op-eds, etc. Now, I guess we'll open it up if there's any general questions or comments or questions about next steps or questions about legislation. Feel free to throw them into the chat, or if you want to raise your hand and talk, live to the community, we're good with that too. And I think Sean's on Spotlight if you want to take him off the Spotlight for some reason.
He's not.
He's not? Okay. I just keep seeing Sean. Maybe that's just me, but okay.
Well, before we jump into questions, I am also going to add another link to the chat of where you're going to have the opportunity, if you have not done so already, to write a letter to your legislators here in Nevada. So there is a template that comes with this letter, but you do have the ability to edit it, so you can add your personal story and why it is that you are getting involved. So I am about to put that link up in the chat as well.
Great. And thank you everybody for joining us tonight. Are there any other questions? Can a caregiver become an advocate, from Rachel? Absolutely. 100%. Yes, absolutely. And a very effective advocate. Pretty much anybody who is directly impacted by these issues can be an effective advocate. So the answer to that question is 100% yes. And I would just encourage you to just fill out that link that Anna Maria put in there into the chat, and we will be in touch with you and help you through this entire process. What if your person doesn't respond to email? I need a little bit more context on that. Heidi, do you want to ask that? Can you unmute Heidi? And Heidi, do you want to expand on that question?
Can you hear me?
I can hear you.
Okay, so in my district, I have in the past sent emails and made phone calls to my representatives, and they don't respond. They don't pick up their mail, because I run into them in Carson City and I'm like, hey, I tried emailing you. Oh, really? No, there must be something wrong with my email. So that's really typical.
Phenomenal question. And that's why there's kind of multiple steps to this. So without having, because oftentimes legislators are bombarded with mail and phone calls throughout session. Hopefully they are all reading it, but if you're not receiving a response, I can guarantee you that every single member of the Nevada Assembly and Nevada Senate has Google alerts when their name is mentioned in a news article. That's why I encourage people to write op-eds and talk about what district you're in and how you'd like XYZ legislator to support or oppose a bill. That they'll see for sure, and it definitely helps provoke a response. Heidi, do you want to share any of the tactics that you may have used when they don't respond?
I don't know if you want me to.
Okay, we brushed over that.
Okay, so the most interesting one I ever had was it was senior day on the Hill, and I got invited to sit next to someone that was not that I was not a constituent of. And I looked to my left, and it's very tight quarters, and there is my person. There she is, and I questioned her. I'm like, well, why? I said, so, oh, you're my assemblywoman. And I said, how come you haven't, responded to any of my emails? And I got a chance right there to explain to her what my issues were. But clearly, if she wasn't returning emails, she didn't really care. She was just voting with the party along party lines. And the other thing, too, is just to find them out in public, because they're around. If you go to the website, Nevada State website, where they have all of our elected officials, those phone numbers are their personal phone numbers. So it's really easy to make those phone calls. They have no staff. Those are personal phone numbers, and it's really easy to call them up on a Sunday and actually get someone to answer. And it's also really effective if you are fighting or also endorsing a bill, is you just have everyone blow up their phone over the weekend.
Right. I was gonna mention that too as an add-on. Like I had mentioned at the beginning of this call, like we can't have a go it alone strategy, right?
Yeah.
Like, we don't want to operate in a silo on this. Like we are way more effective as a group, right? When we have many voices. And Lisa put in here, like she wants to share that panel presentations, multiple voices are effective and persuasive way to advocate. So, maybe they're not responding to you or responding to your letter, but if they get 50 letters or 50 phone calls, they're gonna see the temperature is up a little bit on an issue, and they need to
Right.
probably need to pay a little bit more attention. So that's why not having a go it alone strategy is really
And
important.
also what we've run into in the past is that they just don't want to listen. They just don't want to change their bill. They just don't want to listen. And then we kind of go guerrilla when it's on the floor.
Yes. Well, are there any other questions? Because our time is running up, and I want to leave a little bit of space if there's a few more moments, if anybody has any other questions. If not, I just would like to encourage everybody to please, raise your hand by filling out that link and giving us the intent of what you'd like to maybe participate with us on this session, and we'll be in touch to help you every step of the way. And on behalf of the entire team, Recovery Advocacy Project, and everyone who's worked so hard on these pieces of legislation to get us to where we're at today, thank you. Thank you for showing up tonight. And we'll see you virtually in Carson City in a few days. I guess we're all going to be able to participate in a different way this year. Please stay safe, everybody. Thank you for your participation, and we'll be in touch in the next couple of days. Thank you all.
Thank you, everybody.